So good morning, everyone. Welcome to our series class. Give me 1 minute as I prepare myself. Okay, yeah. So we will be waiting for Dr. Lim to join, and we will
Yeah,
wait for another 5 minutes. Doctor, you are here. Oh,
yeah, I'm here. Yeah,
very
good. Yeah,
good
good morning.
morning.
Good morning.
Good morning. So our class is already
Yeah,
set. Almost 44 people are in the classroom,
yeah, that's good.
and
Yeah,
yeah. So as we continue our study, Doctor, on the Shang Han Lun, we have
yeah,
been
yeah,
studying this. We'll take the next set of verses for today.
yeah.
Yeah. So give me 1 minute. Yeah. Yeah. So, Doctor, today's verses will be 41 to 50.
Okay, okay.
Okay. So, let me
Yeah,
start reading with your permission.
yeah. Please proceed.
Yeah. So, in exogenous disease, when there is water chi congested below the heart with coughing and slight panting, fever without thirst, if after taking the decoction thirst appears, this means the cold has been dispelled and the disease is about to resolve. Then Xiao Qilong decoction governs this. Formula 11.
Yeah, yeah. Now, this chi here mean energy.
Okay.
Water congested below the heart. Below the heart mean upper abdomen.
Hmm.
How do you know that there's water congestion? First, coughing. When the water is in the lung, it causes coughing and panting.
Hmm.
Okay, coughing and panting is a sure sign that there's water retention inside the lung. Okay, then for the upper stomach, bloating,
Mm-hmm.
bloating and sometimes with nausea,
Hmm.
sometimes with nausea. Okay, now here is very important. That fever without thirst.
Hmm.
Fever without thirst, that means there's no dehydration.
Hmm.
Fever with thirst, you have to suspect dehydration,
Hmm.
which is opposite to water retention.
Hmm.
Okay, so if after taking the decoction, no thirst appear.
Hmm.
Okay, that means they already removed the water, no?
Hmm.
Okay, that thirst appear. That means the cold has been dispelled. Okay, then it's about to recover. This is a good sign.
It's a good
Okay,
sign.
you see when the water retention there's no thirst.
Hmm.
After you remove the water, then the thirst appear. Actually, it's a good sign. That means the
Hmm.
balance back. Then a xiao means small.
Hmm.
Qin long means a green dragon. Because Chinese, they believe that dragon is the animal that govern the water, the rain.
Uh-huh.
That's why xiao qing long means the dragon that govern the water. Why govern the water? Because of the lung and also
Hmm.
upper abdomen. This formula is very very famous formula because
Okay.
for chronic cough, chronic
Mm-hmm.
cough, chronic cough due to this water retention of lung, this formula is very, very useful.
Okay. So, Doctor, to summarize, we understand that water congestion, if it's in the lung, coughing and panting are the two signs that we will see.
Yeah, yeah,
Then, if it's on the upper stomach area, then bloating and nausea is what you can see.
yeah,
Uh,
broken nose, yeah.
yeah, and
And
when
sometimes we can hit the stomach,
yeah, by
yeah, and listen to the sound.
yeah, tapping the stomach, you can actually
Tapping
know
the
whether
sound.
it
Yeah,
is filled with air or filled with water.
yeah. If air, it give you a drum sound.
Drum sound,
Then if water, give you the dull sound.
yeah, dull sound, yeah.
Yeah, yeah. We can
Then
we can know. We can know.
this is a very good sign that you have fever without thirst. That means there is enough water in your body. That is why you
Yeah,
don't
yeah,
feel thirsty.
yeah,
And
yeah, yeah.
when you have taken the right dose of the Xiao Qinglong,
Long, yeah, yeah.
then that means that when the water is eliminated and you feel thirsty, that means your treatment is good.
It's a good sign. It's a good sign.
Fantastic. Okay.
Yeah, 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 yeah.
Yeah. Next slide.
Next, yeah.
In EXO-ing disease, when the exterior signs have not yet resolved and the pulse is floating and weak, it should be resolved by sweating. Quitcher decoction is appropriate. Then
Yeah,
there is a formula of Quitcher, shower.
yeah, 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 yeah. I think the
Yeah.
formula you all can
Is
go
yeah.
and read into
They
that.
can read themselves.
Okay.
Yeah.
Only thing is that you see the key word is that floating and weak.
Hmm.
When you touch a pulse, softly, then you can feel the pulse and it's weak. I mean the metabolism is weak.
Hmm.
Then the cinnamon is good.
Hmm.
Cinnamon is good.
Okay.
Uh,
After a short while, sip one sheng with hot thin rice gruel to assist the strength of the medicine. Obtain a slight sweat. So,
so,
doctor, here,
there's some spelling mistake. It's not 字母干燥, it's a 次干燥.
Which one,
remove the
doctor?
mole. Yeah, the Licolice.
Okay, okay, okay.
It's not 子母干草, and also 大枣, no, ZAO, not JAP.
Z
Usually
A O.
JAO, yeah, yeah. I
Okay.
think this formula is quite standard, nah? Quite
Yeah.
standard. Yeah,
Yeah.
yeah, yeah. Quite
Okay.
standard. Yeah, yeah.
Next slide.
Next slide, yeah.
In the exoin disease, if after purgation there is slight panting, this is because the exterior has not yet resolved. Quitcher decoction plus Hopo,
Upo,
Hopo and Xingqi
stringent.
uh, governs this. Formula 13.
Yeah, you see, when you push, no, when
Huh.
you push now, you push the energy down.
Hmm.
Okay, but the exogenous problem is still there, no.
Huh.
Okay, then the body will push it forward to counter
Yeah.
it, no. That will always cause
Okay.
asthma and cough, no, asthma
Hmm.
and cough. Okay, then in this case they use the magnolia bark.
Hmm.
Okay, and also this what do you call apricot kernel,
Hmm.
apricot kernel. Okay, in the absence of what do you call magnolia bark, you can use fennel,
Hmm.
fennel or coriander seed.
Hmm.
Fennel, coriander seed, I think is you use it in the cooking, no?
Yeah.
Okay, then this apricot kernel is easily available
Easily available. Yeah.
in supermarket.
Doctor,
I think in India it should be easily
available,
available. I think.
available,
Yeah,
available.
available. Yeah, even in Europe and many because this is it's very similar to almond. You know,
Yeah.
it's very similar to almond, but almond are bigger size.
Hmm.
Almond bigger size. No, and this apricot gonna a little bit bitter. Sometimes we
Uh-huh.
also call it the bitter apricot. Okay, then we blend it into powder. Okay, then it's very good to replace milk. You know, then it's good for cough. Apricot, you see, cough is a very common phenomenon. No?
Yeah.
Okay, so sometimes when the cough is due to water retention, this apricot kernel is very good.
Fantastic. Doctor, one
Yeah.
logic I understood here is when during the exogen, when the exterior has not yet resolved, the condition is not resolved, and one gives purgation, means he's
Oh,
trying to push,
wrong.
then
Yeah,
the
yeah,
body is trying to resist and go upward. That is why you have panting. Is that
yeah,
so?
penning. Yeah. It's so, it's
Ah,
so.
understood.
This quick doctor, they simply push, no?
Hmm.
Then they push, then the patient have a water retention. The water push up, you know. Then the
Hmm.
lung are full of water. Then they started panting.
Oh.
Okay, and also coughing, you know.
Hmm.
Yeah, this is quite common when due to the wrong treatment.
Okay. Let's
Yeah,
take the next slide.
yeah.
Yes, then we have the formula which we will be sharing with everyone. We will be giving
Yeah.
it
So
contemporary.
when the student have time, please study that.
Yes.
Yeah.
Uh, okay, next slide. Okay, notes for exogenous disease. Purging is a wrong
Wrong
treatment.
treatment.
For all exogenous disease, doctor.
Yeah, you should not push for
Okay,
all. So when a person have aversion to cold, have headache, oh, never push, no.
never purge. Wow,
Yeah, headache and joint pain, don't push.
the very
You
important
you
lesson.
push only when they are having this
Ah,
constipation, and also have a strong fever,
hmm.
constipation, you know. So when a person the stool is normal, never push.
Yep, that's a great lesson.
Yeah.
In now
Exogen.
verse 44,
Yeah.
exogen disease, when the exterior signs have not yet resolved, purgation must not be applied. To apply it is a wrong treatment. If one wishes to resolve the exterior, the Guiche decoction is appropriate. Means
Yeah.
rather than doing purgation, use Guiche.
Which is yeah,
Guiche,
cinnamon.
that is much better. Ah,
Cinnamon is a tonic, you know.
uh-huh.
It can boost the metabolism,
Yep.
and it's very good for depression also.
Mm-hmm.
When a person metabolism is big, they also a lot of depression. So I
Doctor,
also
when
use this to treat the depression. You know, many
ex-
women, yeah, after especially after this birth, no, this postnatal depression is a quicker decoction is very good.
Doctor, exoin, basically when the metabolism is low,
Low, low, low.
What are the mental like other than depression? What are the
No, they
mental
become
signs?
quiet. No, the
Okay,
person become
become
quiet,
uh,
depressed. He doesn't
uh,
want to talk. Okay,
uh,
then the movement become
slow,
less,
uh,
less. Then check the pulse.
pulse.
The pulse always weak.
Hmm.
Then check the tongue. No, tongue also pale.
Hmm. Hmm.
So no, no, this is a common sense. No, you can check all these things.
Yep.
Yeah,
Okay.
yeah.
Next slide.
When a person is talkative, very
Is
agitated, no, no, then
young.
extra young. Yeah, yeah, yeah.
Ah. In exoing disease, if sweating was first induced and the condition did not resolve, and purgation was then applied again, if the pulse is floating, it will not heal. Floating indicates that disease is on the exterior, yet purgation was wrongly applied instead. Therefore, it did not heal. Now, the pulse is floating, thus, it is on the exterior. One should resolve the exterior and then it will heal. Quitzer decoction is appropriate. Notes: here, the sweating is due to wrongly
Wrong
applied
person, Ma Huang.
tongue,
Yeah, yeah.
yeah, which is a wrong treatment for Xuying, where the metabolism is weak. Yes, doctor.
When the metabolism is weak, you don't use ephedra, no.
Hmm.
Don't use Ma Huang. You further reduce the metabolism
Hmm.
because the Ma Huang is cold, you know. It further reduce the metabolism. Okay.
Hmm.
Now, when you say sweating, also you have to sweat it rightly, you know.
Hmm.
This is quick one is called warm sweating.
Hmm.
We're using warm herbs to sweat to boost the metabolism. So when you use a cold herb to sweat, you know, like using ma huang or using this peppermint, you know, then the disease may not heal.
Doctor, can you explain me this logic of how cold herbs also can cause sweat?
No, yeah, certain cold herb can, like I say, mint, peppermint is
Mint.
a cold herb, it can cause sweating.
Oh, it causes sweating. Okay.
That normally for this fever, no,
Hmm.
for this fever with dry skin.
Hmm.
People with dry skin, they have this water congestion, you know,
Hmm.
in the lung or in the stomach. When we say flu, there's so many types of flu, you know. There
Hmm.
are lungs flu, there are stomach flu, there are this uni bladder flu, there are also colon flu, and also this muscle flu. 5 types of flu.
Hmm.
Okay, for lungs flu, we always use ma huang.
Hmm.
For stomach flu, we always use gui you know.
Hmm.
Then for this urinary flu, we're using this poria
Hmm.
to induce the urine. Then for this colon, you know,
Hmm.
okay, colon also we use this they want to or this gherkin, you know, to
Hmm.
regulate the this thing. Okay, so different flus we use different medicines.
Doctor, now you just said dryness of the skin is also possible due to water congestion.
Yeah, water congestion of the lung. Then
Yeah.
the skin become dry.
Hmm. Okay. And at that time
No,
we can.
it's actually your body try to because your body feel to discharge the water. That's why the water return in your lung.
Ah.
You see why you are dry skin because you feel to sweat, no?
The you mean the channels are blocked. That is
Yeah,
why.
yeah, channel block. Yeah, the
Ah.
block the pore block. No, then the water cannot go out.
Oh.
So when the water cannot go out, it go into the lung and go into the stomach.
So at that time, doctor, the patient will have fever, but he will not
Oh,
have
they have
thirst.
cough. They have cough,
They have cough.
fever,
Yeah.
cough, painting,
Hmm.
nausea.
Wow. Logical.
Then this ephedra is good.
Okay. 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 Okay.
Yeah, yeah, yeah.
Yeah.
No, you
Next.
see, one, no nausea, no.
Hmm. 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 Hmm.
No painting.
Understood.
When cough, you don't use 龟枝汤.
Hmm. Hmm. Hmm.
Cough, the mean the water retention, then you have to use peppermint.
Hmm. 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 Hmm.
You use peppermint or you ephedra.
Yeah.
Here they say the sweating is wrongly used.
Hmm.
Instead of using 龟枝, they're using ephedra. No, then the disease may not
Hmm. Hmm.
you see when the metabolism is low, you're using ephedra, you even
You
further
put
lower your
low,
metabolism.
more
No.
low. Yeah.
Yeah, then you cause cough, you cause cough and this chronic cough, you know.
Hmm.
You see, there are many wrong treatment. You can always see in the clinic, you know. They
Hmm.
cough for a long time.
Hmm. Hmm. Hmm.
Yeah, this is wrong due to the wrong sweating, you know.
And doctor, a good doctor, when he sees that his medicine is aggravating the symptom, he should stop and he should change the
Yes, to
medicine.
stop the mean the wrong treatment, you should
Yes.
not apply wrongly, you know.
Yeah. Do not
Yeah, yeah, yeah.
force.
Yeah.
Okay.
Then no, the basic principle, the metabolism is weak. We use cinnamon to boost the
Yes.
metabolism. As
Yeah.
simple as that.
Simple. Correct.
Yeah, yeah, yeah.
Next slide.
Proceed, yeah.
In Yang disease,
Yeah.
the pulse is floating and tight.
And tight,
There is
yeah. No sweat, no sweating.
no sweating, but fever with body pain.
Uh,
And after 8 or 9 days, it has not resolved, and exterior signs are still present, one should induce sweating. After taking the medicine, if the condition is only slightly relieved, the patient may develop vexation and closing of the eyes. In severe cases, there will certainly be nosebleeds, and nosebleed then brings resolution. The reason
yeah,
for
yeah,
this is that the yang energy, qi, is excessive.
yeah,
Here,
yeah,
Mahawang decoction governs this. Yes,
yeah. You see, the thing said, the tight, there are two things very important, no? Floating and tight.
Hmm.
Okay, like the guitar string, no?
Hmm.
When you hold a guitar string, then dry skin.
Hmm.
Okay, then the fever, body pain. Okay, this is a very serious case, no? So even though you address it lightly, okay, there's still some bleeding of nose bleeding.
Hmm.
When nose bleeding also, they mean the kid go out, no, then the patient may heal. So when you see nose bleed, don't feel alarm, no, it's a
Hmm.
good sign. This is a very serious exoyoung problem. So even you address it rightly. Okay, the disease do not just cured instantly.
Hmm.
It takes 7 or 8 days.
Eight
To
days.
recover.
Okay.
Then
Yeah.
sometimes the nose bleeding.
Hmm.
Actually, when a patient is having exoyoung, if the nose is bleeding, normally the fever will subside.
Hmm. Because the
And
chi has been reduced because the energy that
yeah,
was there.
yeah. I saw in one documentary, in Africa, they even purposely using some gases, no, to stimulate the nose to bleed
Bleeding.
to
Oh.
treat disease. But of course, we don't do that,
Oh.
Let the body do it naturally.
Naturally.
You
Yeah.
don't induce nose bleed. No, no, don't do that.
Hmm.
Yeah. So Ma Huang is very good.
Okay. Yeah. Next slide.
Yeah, in the absence of Ma Huang, can use peppermint plus black pepper, no?
Hmm.
With peppermint, the problem is that peppermint do not remove the water retention of the lung.
Hmm.
That's why we put in the black pepper to remove the water.
Hmm. Hmm.
Okay. Sometimes radish also can.
Hmm.
So you cannot use the peppermint purely to replace ma huang, no.
Hmm. You
Uh,
need
you
it
should
with
you should
pepper.
uh, you should with peppermint. No, sorry, you should with this black pepper or with radish. Okay, to remove the water retention.
And Dr. Black pepper is basically hot. So with peppermint cold, it will manage itself.
Yeah,
The
yeah, manage itself. Yeah,
ah
yeah,
yeah.
yeah, yeah. You should check the peppermint. Peppermint
Yeah.
something too cold,
Because
Okay,
it's
you check.
already exo yang, and if you still
Yeah,
give
yeah, yeah, yeah,
peppermint
yeah.
alone is not
Yeah,
sorry, you cannot give black pepper alone directly. You
yeah,
need
yeah. You cannot be
uh,
peppermint.
uh,
It will make the person thirst, no,
yeah, more thirsty,
and agitated.
agitated, more agitated.
But you use peppermint.
Yeah, understood.
Or radish also good. Radish also
Hmm.
good. Yeah, yeah, yeah.
Dr. 47, verse number
Yeah.
in exo-yang disease, when the pulse is floating and tight, with fever and no sweating of the body, spontaneous nosebleed indicates recovery. Oh,
Yes, yes,
it's a
yes.
sign of recovery. Okay.
Yeah, yeah. So you as a doctor, don't get panic, when you see the nose break.
People
It's a
get
it's a body defense system to remove the heat.
Many people actually get scared when they see blood
Yeah,
coming
you get
out.
scared. No, no, no need to get scared. Is a good sign.
Okay, great, great. Okay,
Sometimes
next.
vomit also is a good sign.
Vomiting. Even
Yeah,
sometimes
vomiting.
purgation. Purgation is also a good sign if it does it naturally.
Yeah, yeah, yeah. Sometimes is a vomit also. All the heat will come out.
Yeah, yeah. Doctor, next we go for
Yeah, yeah,
48,
yeah,
verse number
yeah,
48.
yeah.
In dual yang disease, when exo-yang first contracts the illness, sweating is induced, but the sweat comes out first and is not thorough. It then transfers to endo-yang, and continues with slight spontaneous sweating without aversion to cold. If exo-yang disease signs have not yet ceased, purgation must not be applied. To apply it would be a counter reaction. In such a case, slight sweating may be induced. If the facial complexion appears evenly and distinctively red, the yang qi is constrained and depressed in the exterior. It should be resolved by fumigation, heat smoking. If the sweating is not thorough, it is insufficient to treat the disease. The yang qi is constrained and depressed and cannot be released. When sweating should occur but does not, the patient becomes restless and agitated, does not know where the pain is. At times in the abdomen, at times in the forelimbs, on palpation, it cannot be found.
Yeah. You see, when exo yang and endo yang are together,
Hmm.
okay, pure pure sweating is not good, you know.
Hmm.
Pure sweating, you have to sweat thoroughly. Sometimes the sweating are not thorough, okay. Then internally you have to use gypsum, you know,
Hmm.
or you have to use this pearl powder or mother of pearl to
Hmm.
remove internally. You don't do that, you know, okay. Then the patient will be uncomfortable.
Hmm.
Okay. Then worse if they use purgation.
Hmm.
Okay, so all these are wrong treatment, you know. So when a person is having exo yang and also have endo yang, I mean, what do you call, uh, without without
Without chill.
without chill, you know.
Ah.
Without chill, you have to be very careful.
Hmm.
Then you need to apply gypsum. I mean, the lips are normally are very very red, you know, reddish, no. Then
Hmm.
the person have become very agitated.
Hmm.
Okay, then you use the gypsum, you know, or we are using this a pearl powder
Hmm.
or this mother of pearl, you know, to what they call to treat it. This pearl powder, mother of pearl in Malaysia is easily available.
Hmm.
When we go to the thing, I don't know about other part of place, but the extent we are selling it, you know,
Hmm.
the pearl powder. Okay, so we can use that. This case is a complication. I mean, they are exo young and endo young appear together.
Hmm.
Okay, so normally we treat the exo young first
Doctor,
by
what is
induced
it
sweating.
by saying heat smoking? What is fumigation?
Yeah. Now this is this the way is that they put what they call they put a patient on the bed,
Hmm.
then they set out the fire below the bed, you know.
Oh,
Okay, this kind of fumigation. Normally they do it during the winter.
okay.
Normally in tropical country we never do that.
But doctor, here the facial complexion is already evenly and distinctively red. Even the yang is on the exterior side is like the patient is already high. Wouldn't this cause any complication by fumigation or increasing the heat of
Yeah,
the?
yeah, concrete,
Exactly, yeah.
yeah, yeah.
Because then, doctor, if the sweating is also not thorough, then mean now here both young, the
Fumigation to induce sweating.
okay,
Like sauna, you know, it's the same as sauna.
is sauna,
Yeah, sauna. Okay, this thing. But normally we don't do this in
better not do,
modern. We never do that. This sauna is very risky, you know. Because a person is already fever, you sauna him,
exactly,
he may faint, you know.
yeah.
He may drive him into coma.
Mm-hmm. And
Because
doctor
the
here,
problem, Shang Han Lun, the problem is that it have been disturbed, you know, by the wall. Then it's corrected by the student.
so there is add-on, doctor. There is also add-on.
So this one look like add-on.
Oh,
Because this one is not it doesn't look like
logical.
because Zhang Zhongjing he's very concise.
Yeah.
He do not talk so much. So we suspect that this one is by his student, you know, not
Huh.
by him.
Okay, okay.
So fumigation you just ignore it, you know.
Ignore
We
it.
so
Okay.
we don't do that.
Hmm. Okay, then here, doctor, why is this that when sweating should occur but does not, the patient becomes restless? Why is he restless and agitated? Because of the yang
No,
energy,
you
but
see, you see, when hearing this exo young, you should use ephedra to sweat it, you know.
correct.
That's why you do not use ephedra, you use quincy instead.
Hmm.
Then the sweating is not thorough. Wrong
Hmm.
treatment. Wrong treatment.
Correct.
Okay. So when you sweat also, you should sweat accordingly, you know.
Hmm.
When the metabolism is weak, you boost the metabolism.
Correct.
Warm sweating. So when the metabolism is high, you should use cold sweating.
Doctor, here then I can use mint.
Yeah, I can use peppermint.
Yeah. Okay. Okay.
Radish also can use.
Radish can also be used. Okay.
Can use peppermint also can use. Radish also can use.
Okay. 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 Understood. Okay.
Sorry.
So I think the student need not worry because this is a slow learning. We'll have to first day we don't understand, but over a
Yeah,
period
yeah.
we'll keep on reading, we'll
So
understand.
remember, wet skin using
Yeah.
quicker, dry
Uh,
skin and with cough, using ephedra.
Ephedra.
Ephedra is not around, then using this peppermint plus black pepper.
Hmm.
Yeah, yeah. Continue. Yeah.
Yeah. Next slide. The patient has shortness of breath and only sits. This is because the sweating was not thorough. Inducing sweating again will lead to recovery. How do we know that the sweating was not thorough? It is known because the pulse is rough. Now
Yeah,
here,
the
doctor.
pulse is not regular.
Rough means not regular. Okay.
Irregular, yeah. The pulse because erratic,
Mm-hmm.
Yeah, yeah, yeah.
Okay. Notes, this is the Dachi long tongue, that's a major green dragon syndrome. For example, acute influenza or pneumonia, where
Pneumonia.
strong induction of sweating is necessary. But instead, the doctor just induced the sweat weakly using the Mahawang or Quichitang, which is not sufficient to induce the sweating to treat the disease. The wrong treatment sometimes lead to the heat to travel inwards and resulted in endo-yang disease with slight sweating and no aversion to cold.
You see, for example, when this acute influenza or acute pneumonia, they
Hmm.
have very high fever and very strong chill, high fever, strong chills, and very, very agitated,
Hmm.
Okay, then this major green dragon is a very effective this thing. It will cause excessive sweating
Hmm.
because this is very serious case. So if you use ma huang or you quizzes not enough, the
Hmm.
sweating not enough. Okay, how do you know that you need aggressive sweating? Is that okay? It's a very strong chill,
Hmm.
strong chills and vexation in and the patient is very very agitated
Hmm.
and he's not cannot sit quietly,
Hmm.
they I give you one example, one doctor he said he treated one case, one fisherman
Hmm.
when the day are very heat, very very the weather very heat is sweating, then he jumped into the river to catch a fish.
Hmm.
Then after that, they go back, he develop very high fever
Hmm.
and a strong emotion of a chill, Okay. Then when the doctor induced using ephedra, it's not effective.
Hmm.
So he had to use this major green dragon decoction, okay, to strong induce the sweating. But you have to be very careful, when you apply this thing, never use it too frequent,
Hmm.
It'll cause dehydration and sometimes it can be fatal. Some case dead, due
Hmm.
to over induction. That's why when the sweating cannot be stopped, then immediately you have to use the thick cinnamon decoction,
Hmm.
sini, and dry ginger. Drink to stop the sweating.
Doctor, here my one question is now here when we see that acute influenza and or pneumonia, these are the conditions which when people get, they are usually in a hospital setting which is already cold. So rather than inducing sweat, they are put into an environment which is going to prevent sweating. Is that
Uh,
risky?
no, risky. The patient
Very
may die.
risky.
The patient may
Oh,
die.
oh.
You have to remove the kid, no. Instead, you steal the pole, no. The the
Ah,
the patient may drip into coma, no. We have seen a lot, and they die. Even in my village, no, it happened before. They go to hospital, they put into air condom, then the patient died.
yes.
Died.
My goodness. Okay.
So that's why we say that even this ancient knowledge, no, is also important, It doesn't
Yes.
mean that you go to the modern hospital, everything will be okay. Not
Correct.
necessarily. Yeah, yeah.
Yep. Next slide, please.
Because when they say that a high fever,
Hmm.
then they put a very strong aircon.
Aircon. Yeah.
Nah,
18
nah,
to
nah.
18 degrees, doctor.
The cold air steal the pulse even more, no?
Ah.
Then the kid was locked inside the body, then the patient died. My
Hmm.
village last time a few fatal cases, no? high fever, send to hospital, then they send to the ICON room, then they died. I think 2 to 3 cases.
Hmm.
That's why in my village, when they have a high fever, they dare not send to hospital. They send to my father.
Better,
Then my
better.
father using herbs to reduce this thing. Yeah,
Okay. And verse 49,
yeah,
when
yeah.
the pulse is floating and rapid, by principle, sweating should be induced and recovery will follow. If purgation is applied wrongly instead, and there is heaviness of the body and palpitations of the heart, sweating must not be induced then. One should wait for spontaneous sweating and then it will resolve by itself. The reason for this is that the lower chi position pulse is faint, indicating interior deficiency. When the exterior and interior are both weak, the fluids will harmonize on their own and the spontaneous sweating will occur, leading to recovery. Doctor.
Yeah, when the wrong treatment. Okay, then the purgation is applied.
Hmm.
You don't simply take the patient. Let him take rest.
Yes.
If you try to interfere with him, no, then it may even what do you call? It may even harm him further.
Hmm.
Then when you take the pulse, no, there are two positions. Okay, let me see whether I can show it in
Yeah.
three finger, no,
Yeah.
yeah, yeah, three finger.
Three finger.
So the what do you call? The top one is chun inch.
Which one? The one? Yeah.
Now three finger,
Yeah.
three finger. Okay, this one is the one near to the thumb.
Near to the thumb. Okay.
It's chun. Chun mean inch.
Uh-huh.
Then this one further away from the thumb.
Uh-huh.
Che mean foot.
Mhm.
Okay, so this one is the ex- is a exogenous problem.
Okay.
Okay, this one is a endogenous problem.
Mm-hmm.
This one is the intero.
Ah.
Okay, this thing. Then for the pulse, from 3% of pulse, you can know the body condition.
Mm-hmm.
This one you need training. When
Mm-hmm.
next time when we come to the sunya practice,
We will
then
teach.
we have to train. We
Yeah.
just by description of this it doesn't work.
Correct.
Okay, this thing. But you can feel it. Okay, if both the top and bottom pulse, if they are weak, they mean the body are very weak. Better don't disturb the patient, no. Okay,
Mm-hmm.
let him take rest, no, recover by itself.
Wow. Yeah. Understood. Yeah, so here there is a way in which the body can recover itself. So when the pulse is floating, doctor, next verse 50th, the last one for today. When the pulse is floating and tight, by principle there should be body pain and it is appropriate to resolve it by sweating. If hypothetically the lower pulse, that's the chi position, is slow, sweating must not be induced. How is this known? Because the nutritive energy, chi, is insufficient and the blood is scant.
Yeah, you see, very important. When the pulse is floating and tight,
Huh?
by then is have body pain.
Hmm.
Okay, now this patient he do not have body pain.
Correct.
Okay, then the lower pulse is weak. Okay, that mean is body fluid is insufficient.
Correct.
Then the blood is insufficient.
Ah,
You don't induce sweating, induce sweating, you call dehydration.
so logical. Yes.
So when the lower pulse, when the lower pulse is weak, okay, and the body do not feel pains,
Hmm.
then is a dehydration.
Doctor, pain in the body is a sign of obstruction, but there is fluid in the body.
Yeah, yeah, yeah. Pains normally is water retention.
Water retention.
Pains and heaviness.
Heaviness of the
Yeah, yeah,
limbs,
yeah, yeah.
heaviness of the body
So
is water.
when it dehydration, normally it's a dry skin.
Ah.
Then or sometimes they have this thirst.
Hmm.
They thirst and they have this dry throat.
Hmm.
Okay, then dry cough,
Hmm.
coughing without frame.
Hmm.
So these are dehydration. You should never induce sweating.
I think this is a very important lesson, doctor, to differentiate between water retention symptoms and
Yeah, yeah, yeah.
dehydration symptoms. Water retention symptoms, the same cough, but this cough is not
Yeah, the
dry
cough with phlegm.
phlegm. But
When you
when
clear
it is
phlegm, then there's a
dehydrated,
panting now.
panting.
Panting,
Ah.
panting. Panting is a very, very strong indication of water retention. Okay. Then stomach is bloating,
Hmm.
nausea.
Correct.
Yeah. This is the thing. So if there's no nausea, no panting, the dry cough, okay, the dry skin, okay, no body pains, then you should suspect dehydration.
Hmm. Yeah, I think that's very clear.
Dehydration, yeah. Yeah.
Very clear.
See, to check whether it's hydration or dehydration is very important.
I think that
As
is
a
the
doctor.
key, doctor. Here, Chang Chung Chung is pointing us towards that the hydration and dehydration are the two important things because
Yeah.
you're purging or you're sweating because your line of treatment is also with the water itself, right?
When hydration, you can cause sweating.
Correct.
When dehydration, no, never sweat.
And don't
Because
even purge.
this is common sense. If
Hmm.
the body already lack of food, you go and sweat him, he die.
My goodness.
No,
Yeah.
no, die. Be careful of factor. When a person is suffering for dehydration, you use da qing long tang, die. No, many cases die. Many cases. That's why when we study Shang Han Lun, when come to da qing long tang, the what they call the teacher always caution, no, be very careful.
Hmm.
Okay, so when the pulse is weak, don't use da qing long tang. No,
Hmm.
when
Hmm.
the
Hmm, hmm.
pulse weak normally is also indicate you suspect dehydration also. Low in metabolism or low in fruits.
Yep. I think very clear. This.
Yeah. So all these are common sense, no? All
Yes.
these are
Yes.
common
Yes.
sense. Yeah.
But so, doctor, this is the end of today's 10 verses. We'll open the
Yeah,
floor
yeah,
for
yeah.
questions.
Yeah. We go a little bit fast,
Yeah, yeah,
this thing. So you have any question, please ask
yeah.
us.
So we just see if there are any questions.
Now
Doctor, somebody,
let yeah, please.
somebody asking what for COPD, that's chronic obstructive pulmonary disease. What do you suggest? No fever, only obstruction because of the chronic obstructive pulmonary disease
Yeah,
where,
yeah.
yeah,
Then you have to remove the water, no, through urination.
okay.
You induce urine.
Hmm.
If there's no fever, no episode induce urine, you can use sporia.
Mm-hmm.
Euphoria and certain vegetables also can induce urine, no?
Hmm.
Even radish can induce urine. Then this ash melon,
Mm-hmm.
ash the big very big melon one,
Yes.
the winter melon, ash melons. Where in India you also do cookie from it.
Yeah,
The
yeah,
one ash melon to induce poria also very good.
mm-hmm.
The extent they poria, no. So if they only have this chest fullness, no, but there is no fever, then you induce urine.
Yeah. Doctor, next question by Dr. A. Mukheet is that for cough, dry with sputum, dry cough, but
Yeah,
with sputum is also there.
yeah, with
Fever,
phlegm.
subsided. How do we
Yeah.
treat? Only dry cough.
So this dry cough, normally we put radish
Hmm.
with black pepper.
Hmm.
You see, radish with black pepper is cold and warm together, no?
Hmm.
Then let the body decide which one to use.
Doctor, here I understand the way you are assuring us that the body is smarter than us and it can choose.
Yeah.
Oh,
The body
really?
you choose.
Oh,
Yeah, which one is better for it? Yeah. So we put radish and black pepper together.
yeah. Okay.
Mm.
Yeah. Next, if you have any questions, you can please raise your hands and we'll take up those questions.
And we seldom use chili.
Mm-hmm.
Sometimes chili also is very warm
Mm-hmm.
to warm the body also, chili. Yeah.
Doctor, you can use chili for medicine?
Yeah. We use chili for medicine.
Oh, wow.
Yeah. It's chili and chili and cinnamon and dried ginger.
Mm-hmm.
They are these warm herbs.
Yeah. Okay, doctor,
Chili is a very good medicine.
we will take four questions. We have four hands raised.
Yeah. Please.
Okay. So,
So the
Kanaklata
reading,
Kumari
yeah.
ji. Yeah, please. Kanaklata, can you ask your question?
Good morning, sir.
Yeah, good morning.
Sir, can you hear me?
Yeah,
Yes.
I can hear you. Yes, yeah, clearly.
So, sir, my question was that what shall we do about the measurement? Because every time we can't measure it accurately. So, is there some technique or idea of how to know that this much medicine or this much herb is required?
You mean the quantity of medicines?
Yes.
Yeah. No, you see, when it's dry herbs, the main herbs we use about 9 gram. Okay. When it's fresh herb, we use about 30 gram, 3 times. 9 to 10 gram, 9 to 10 gram for the dry herbs, 30 gram, one serving, 30 gram is the normal. Okay. Then for the supporting herbs, is a 6 gram. 6 gram. Then for the wet herbs, no, okay, is about 20 gram. Not you no need to be too exact,
Specific.
not exact, Okay, with a few practice, you know how to manage the weight. Yeah,
Yeah. Next,
Okay.
we
And
have.
so next question was
Okay.
yeah.
that if some endo disease is being treated and some exogenous symptoms appear, so shall we treat it or leave it to heal itself?
If fever, we always no. If young fever, we always treat the exogenous first, then we go for endogenous. Yeah, but if it's very weak, okay, endogenous, for example, loose motion. Then at the same time also you have this exogenous system. Then we will treat the internal one first. We'll stop what do you call the diarrhea first. If the body is weak, we treat the internal one first. Okay. If the body excessive, we treat the external one first. Always remember this as a doctor.
So, doctor, that means priority is always to the weakness.
The weakness, you treat the weakness first.
Yes.
Okay. Then if excessive, we treat the external one first.
So, yin is always the priority, yang is secondary.
Yeah. No, no,
Okay.
no. Depend on the condition of the body.
Okay. Then, doctor, the other way around also, it can happen that yang can be a priority and yin secondary.
Yeah. No, when for example, when exo young and endo young happen together, you
Huh.
remember?
Yes, yes, yeah.
They say
Recent.
where it have this what do you call? You have exo young.
Hmm.
Okay. Then at the same time, you also have delirium, no?
Yeah, correct.
Delirium. But the power is weak.
Hmm.
Okay, so in this case, they use this dried ginger and licorice, no?
Oh.
Okay, warm herbs, no? Even though it's delirium, no? Okay, to boost the metabolism.
Hmm, 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 hmm.
So when metabolism is weak, no, we always take care of the metabolism first.
Understood. Yeah, I
Yeah,
think
yeah, yeah.
Kanaklata also understood.
Yeah.
Thank
Very
you so
careful.
much.
You
Yeah.
as a doctor,
So
no, metabolism, you don't interfere with metabolism, no. If the metabolism is already weak, even though they have high fever, no, never use cold herbs.
Yeah.
Cold
Okay.
herb will bring down the metabolism even further, and the patient go into coma and very risky,
Yeah. Okay, doctor.
actually, what happened is
No, no, no.
Please,
Let
please,
let
please.
Kanaklata
Continue,
answers.
continue,
Yeah.
continue. You
Yeah,
can ask the
Kanaklata,
question.
please, please. Huh.
Yeah.
so she had breast tumor. So for that purpose, we were giving her RGGL and spirulina, and consequently, she started gaining problems from the knees. Okay, and now it has reached till breast. Breast is paining, shoulder pain, back pain. So, is the disease trying to normalize, or is it something else?
Yeah. No, this is different, no. We are talking about cancer, ne?
Hmm.
Okay,
No, no,
cancer.
breast tumor,
Yeah,
not
The
breast
tumor,
cancer.
breast cancer. Huh.
and cancer, the same tumor. Yeah.
Huh.
When this is a tumor, we take RGGL, there is a lot of reaction. Sometimes the body feel pains, sometimes this thing, no need to worry about that. Continue. This reaction is quite normal because the tumor is blockage, no? The blockage always cause pains.
Hmm.
So when you try to open up the blockage, no, it causes a lot of pains.
Doctor, any soup that we can recommend along with this that they can take veggie soup?
This one is the veggie soup. Can put ginger soup, ginger,
Yeah.
tomato, ginger, what all this thing, and also this kakan, kakan,
Yeah.
and also the vein, any vein,
Any vein,
for
vein.
vein like this grape veins, or this mulberry twigs.
Mulberry twigs also can be taken.
Mulberry twigs also can, yeah.
Okay. Yeah.
But put RGGL and easier lah. RGGL mainly, and
Yeah.
also together with the spirulina. Yeah.
Okay. Now we have Sana Gandhi
Yeah.
Rajshekhar ji. Yeah. Yeah,
Yeah.
Rajshekhar. Your question,
Yeah,
please,
the,
Rajshekhar. We
is
cannot hear
not
you.
clear.
Sponsor is the Dr. Venkateswar.
Rajshekar, we cannot hear you. So maybe
The
you
the,
come
the
back
line is
in
not
some
clear.
range. We take the next question. Manjunath, can you ask your question?
Yes, good morning, doctor.
Yeah, morning.
So I have a three question. One thing is regarding me. You already told me when we are dehydrated, we are getting low sweat. But I'm feeling like that I am dehydrated also, and I'm getting most sweating every time. So that what confusing me. So I already you told me
Yeah,
last time we are
yeah,
taking coconut this thing water. Then it will be very helpful for me. So again, I'm taking lots of water, but still I feel dehydrated and
yeah. When
so
you, yeah,
yeah,
when you are dehydrated, yet you're sweating, the mean your body are weak,
okay,
Your body are weak, this a thing. So that you should take to nourish your hydration, okay. Our RGG is good, okay. At the same time, you also can take honey. Honey can hydrate the body properly, honey. Okay, you can drink honey. Okay, honey can hydrate your body, and you can also take this peach, the fruit, the yellow peach.
Peach.
Okay,
okay.
when you always dehydrated, yet you have this sweating along, you can take this peach. Okay, it's good to hydrate the body. Honey also can hydrate the body. Peach, honey also can hydrate the body. Yeah.
Okay.
Honey with the, how I have to take with the water or
Take with water. You can take with spoonful of
No,
honey.
the problem is that sometimes the water out of balance. Even taking the water will not have the problem,
No,
Because the
he's
problem
doctor.
because
He's asking how to take honey.
the honey just what do you call
Just take a spoonful,
yeah, put with some warm
warm
water.
water. You can take. Yeah.
Yeah, put two times the
okay.
warm water,
Yeah.
then you can drink. Yeah.
Okay.
Yeah, another question regarding my son. He's whatever he will take, like even he take juice, ice cream, or food, anything. He will drink lots of water. Now, recently, from 2 months, he's continuously having a, loose motion or vomiting like that. But yesterday he got a little fever. But whatever this problem is for me, he's only
Yeah.
taking medicine product. He is resist to take any medicine till now. So whatever problems will come, he will take lots of
Yeah.
water and he will
You
take a
see,
spoon.
when a
Yeah.
child take ice cream and having loose motion, they mean the stomach is very weak,
Hmm.
Right. So what you can do is that you can take a sweet potato
Okay.
or potato, boil it with ginger, and put some jaggery, put some this brown sugar, and drink only the soup, Then it can
Okay.
stop the diarrhea. It can stop the this thing. And this is a very common problem.
Hmm.
Okay, when the stomach is weak, this thing, and at the same time you can also use jujube,
Okay.
with ginger, jujube with fresh ginger. Okay, it's good for the stomach. Or this a sweet potato with ginger, or
Okay.
potato with ginger. Drink the soup. No need to take the potato. Yeah.
Okay.
Okay.
So
Next
Your,
question. We
your
can.
third question, yeah.
a third question is yesterday in my office, all of a sudden one family came and they requested me. Their son around 18 years old, and he's having his hands like shaking, and he
Checking,
don't have any, yeah, other he don't have any other problem. Then they went to doctor. They told he is having problem in his brain. Some nervous blockages are there, and lots of treatment they told, but they are not ready to do that because it is very expensive like that. And I said, okay, I will get back to you very soon. But the meanwhile, I given them Moranzi and our linesman. But today morning I got a call when just one dosage. Yesterday night they taken only two linesmen and half sachet of our Moranzi powder with the hot water. So he got a three times loose motion. Before that, I also asked, do you have a stomach problem? He said no. But after taking this problem, this product, he got a three times loose motion.
yeah,
Uh,
good thing.
so, so this what solution I can provide them.
Actually, this nerve, weak nerve,
Yeah,
weak metabolism. That's why the leg are shaking, So when you
yeah,
take Morinzi and Lion's Mane is a good treatment. Okay,
yeah.
then the loose motion due to detoxification,
Yes.
liver toxin, Let it lose motion, am I? After some time, continue, continue. Okay, this to strengthen the nerve, no? Okay. So when they strengthen the stomach, then when the stomach detox now, it can cause loose motion. No need to worry. When you take RGGL, take all the product, having loose motion is a common thing, No need to worry. Sometimes people also can vomit, Also, these are common reaction. Okay,
What
nothing to
product I
worry.
can suggest
Continue
along with
with the
that?
Linesman and also Morinzi. It's good for nerve, Good for nerve,
Okay.
yeah.
So Manju, we
Yeah.
take the next question from
Thank you,
Yeah,
Ayla
yeah,
sir.
Sayon. Yeah, thank you so much for your question.
yeah.
Miss Ayla,
Yeah.
morning. Yeah, your question.
Morning, yeah.
Good morning. Thank
Morning,
you
morning,
for
yeah.
all your supports.
Yeah.
I have two questions. The first one is you use cinnamon almost all of the receipts, but as far as I know, cinnamon lowers the blood sugar. So if one is medicated with blood sugar medications, normally we don't suggest them to use cinnamon to have diabetes problem, low sugar problems. What do you think about it?
No, it's not like that. It's not like that. Okay, yeah. Cinnamon is a medicine, no? Okay. When we use cinnamon, when it had a symptom, for example, sweating, Okay, the body are voluntarily sweating. Okay, having aversion to cold. He doesn't like wind, Okay, then sometimes have this body pains. Then we can still use cinnamon. Okay, it won't interfere much with the sugar level. You use it one or twice, it's okay. You don't use it all the time. Okay, when the people are taking the sugar medicine, if you drink cinnamon every day, no, there's no good. But you just use it one or twice to treat the problem, that's okay. That's okay. So you can still use cinnamon, even though a person suffering from diabetes, you can still use cinnamon. Yeah.
And
Okay. For this for this aversion of cold. Okay. For the sweating problem. Okay. And for depression problem.
doctor, and we are using here cinnamon twigs, not the bark.
Yeah. Cinnamon twigs. Yeah.
Ah,
Not the bark. Not the bark.
not the bark.
But the problem is that you do not have cinnamon twigs. Then you can use onion.
Onion, yeah, or leek.
Yeah. Onion and tomato.
Hmm.
Use onion tomato, you won't interfere with the sugar level. No need to worry.
Yeah.
Onion tomato are quite okay. Yeah.
Yeah. Second question, ma'am.
Yeah. The second question.
My
Yeah.
second question is I have what you call reflux problems, stomach problem, and I use lion's mane, but I don't know how much I should take lion's mane.
What is the problem?
Gastric and stomach problem.
Oh, gastric. Lion mane, of course, is very good for gastric. Normally, we take about 6 to 12 capsule a day. Normally, you take 6 a day. 6 capsule a day. A tablet, you can take a little bit more. Tablet, you can take about 12 tablets a day.
In the morning when I'm hungry or with food?
It doesn't matter. It doesn't matter. You can take it
It doesn't
empty
matter.
stomach or can take it full stomach. It doesn't matter. Our
Okay.
product doesn't matter. Yeah. Alignment is very good for gastric. It's very good for gastric. Yeah.
Okay. Thank you so
Thank
much
you.
for
Yeah.
the
Thank
question.
you. Yeah.
Yeah.
Next
Manharan
question. Yeah.
Hansraj, please.
जी, good morning, doctor.
Yeah. Good morning.
Doctor, I will like to ask about health problem and seek your guidance.
Yeah, please.
From some time, I have been experienced pain in my left leg from thing down to sole of the foot. Along with the this also feel numbness in the sole of my left foot. Sometime here in also pain in the muscles of my leg. I would like to know what could be possible cause of the problem. Uh, uh, Currently, I am regularly consume Dexane product Spirulina RGGL, Dexane tea, coffee, kombucha. So please let me now whatever I sold continue talking this product on my any change. To also my English is not very strong. I am translate my Hindi question into English to ask you. So I possible I would really appreciate if it you call translate your answer into Hindi
Yeah,
for
yeah.
me.
I'll try
Or
translate. Don't
kindly-
worry, doctor. Yes,
or
doctor.
kindly
It's a numbness
provide.
of leg, huh?
Yeah. So on his left leg, he has pain from the knee down to the feet, and he is
Yeah,
also
yeah.
numbness in the leg. So would you suggest? What would you suggest?
This is a circulation problem, no?
Yeah.
Second problem. Second problem, you can take this linesman. Linesman for the numbness, that would be good. Okay, the linesman. And also, okay, your kombucha also can take to strengthen your stomach. Then at the same time, you can do the hand swing exercise, no?
हाँ,
Swing your hand.
तो
Swinging the
आप
hand,
yeah,
okay? Maybe
Yeah.
for 500 times,
yeah.
a
So
few hundred times, no? That can also improve the circulation. That also it can help to what they call to to treat the numbness of the leg. Numbness of the leg is mainly due to circulation problem, no? Then swinging a hand can improve the circulation. Yeah, you try
हंसराज
and
जी
see.
आपको
Linesman also is good. Linesman also is good for this numbness. Yeah.
सो हंसराज जी जैसे डॉक्टर ने कहा कि आप लाइंसमैन यूज़ करो, आपके लिए ये अच्छा रहेगा। मेन तो सर्कुलेशन प्रॉब्लम है, इसीलिए ये नमनेस और ये हो रहा है पैर में दर्द। तो इसके लिए हैंड स्विंगिंग जो हमारा शून्य का एक्सरसाइज रहता है, ऐसे 500 हैंड स्विंग करो, इससे आपको फ़ायदा होगा। और डीक्सिन के प्रोडक्ट्स अभी जो चल रहे हैं वो चालू रखो, कंबूचा भी आपके लिए बहुत फ़ायदेमंद होगा। और फिर एक हफ्ते बाद बताना। यस डॉक्टर।
Morinji also very good for numbness.
या और मोरिनजी भी आपके लिए अच्छा है नमनेस।
Morinji, linesman, these are the main one, you know.
या
These are the main, yeah.
ओके, थैंक यू सो मच।
Yeah.
नेक्स्ट प्लीज।
Thank you, Doctor. So, thank you.
Just now, someone say how to treat anxiety.
Yeah.
Anxiety is a exogenous problem, you know. Okay, you can use this leek soup, the spring onion soup, you know. Okay, to boost the energy. This one for anxiety. And another thing is escargot soup, you know. But I don't know whether in India they have that or not.
No, we
Escargot
don't.
soup also very good for anxiety. Yeah.
Doctor, we take the next question
The next
from
person, yeah.
Amravit. Yeah.
Hi,
Yeah.
Dr. Lim. How are you?
Yeah. Fine.
I'm from Ethiopia. I'm glad to see you, and I'm just happy to talk to you. So my question is, there is a lots of digestive system problem, especially in Ethiopia. There is a gas reflex, in acid reflex, in the colon problems. So what do you
Colon, yeah.
suggest for me? Because
Yeah.
sometimes when they take spirulina, the acid reflex may upset the stomach one. So what do you suggest us?
Yeah, Ethiopia. I think I have been staying in Ethiopia for some time, and all the time. Okay, yeah, especially the weather is quite cold. Okay, then there is a lot of spicy food. I think they're taking. Okay, that will create colon problem. That create colon problem. Okay, so now in Ethiopia, I think you're eating the injera. Injera is good for the stomach problem, you know. Injera. Okay, the only thing is that you need to cut down the spices. The spices, not the India, no. Because in Ethiopia they use a lot of spice in a tropical country, you know. They use a lot of spice in the cooking. Lower down, try to cook the food in plain food, you know. Try not to use too much spices. And the spices is bad for stomach system, you know. It can always cause a stomach problem and a colon problem. The same thing happened to India, you know. Now India also a lot of stomach issue because of the spices. Yeah.
Okay, doctor, we can take.
Yeah, I think the video or not.
Yeah, yeah.
Yeah.
We take
Okay.
the next question.
Yeah,
Samrawat,
please.
did you get your answer? Yeah. Okay.
Ethiopia. Yeah.
Yeah. So next question we take from Sharmista. Yeah, Sharmista.
Good morning, doctors. Am I audible?
Yes.
Yeah. So I have a question related migraines. So I usually have
Migraine.
migraines. Yes. And to to feel better, I do purging. I drink a lot of water and try to vomit. So I feel good after that. So is this practice good, or I should stop doing this?
No.
And
Yeah.
yeah, and one more question, like one more if you suggest any kind of soup, specific soup for migraines, that will be helpful.
Now your problem is a weakness of stomach, no? Okay. The migraine is 90% of the migraine is due to stomach problem. Okay. That's why when you vomit, you feel a little bit better because it detox the thing. Okay. So what I suggest to you is that you can boil a potato soup. Okay, sweet potato. Do you have sweet potato?
Yes,
Yeah,
yes.
sweet potato plus ginger. Sweet potato plus ginger. Then you add in some sugar, no? Okay, that thing. Then you drink only the soup. No need to take the potato. Drink only the soup, this thing. Then at the same time also, our products all Lion's Mane. Rice man is good for stomach. Just not the colon problem, I've forgotten to say, Ethiopia one, you take Lion's Mane. Okay, so once you must regulate your stomach, it had nothing to do with the head, So your migraine is basically a stomach problem. Then when you don't take too many spicy food, cut down your food, less chili, less spicy food, okay? Take more easily digestible food. Don't take those hard fly, those hard fly, those very heavy masala food, these heavy spices, no? Cut down the spices. Okay, everywhere. So I ask people to cut down the spices. The spices is very bad for stomach, Okay, this thing. When you take a little bit, is good for stomach, but you take it every day, Okay, so when your stomach have problem, stomach have no nerve, Okay, it always reflected to the brain. Okay, then you always have migraine. Okay, take care of the stomach. Okay, so when migraine, another thing is that you can drink coffee. Can drink the coffee, the coffee is also very good for. Before the migraine come, sometimes you feel numbness of the head, that time you drink a cup of coffee. There's some coffee. Then
I used to drink black coffee. Black
yeah,
coffee,
black
but
coffee, yeah, it's okay. Black coffee is okay. Any type of coffee. Black coffee is okay. But take care of your stomach, Remember, it's a stomach problem. Migraine is always the stomach problem. Yeah.
So, doctor, we
thank
take
you.
one more last
Thank you,
question.
doctor.
Yeah, one more last question. Yeah.
Yes, Sweta? Can you unmute? Yeah.
Yeah. Wow, I can see all the bricks below you.
Okay.
Yeah, please.
Yeah, good day, Dr. Lim.
Yeah.
Okay, Dato, I have a few questions here regarding my son. My son did to exam, and after sometimes when it's 12
Depressed.
overpush for the UPSR and depression, it become a what do you call anxiety, and then become a OCD. After sometimes he recover, and then doctors say now currently is a 19 years old. They say they have a mild autism.
Autism, yes.
Mild autism, and then after
autism,
this now they're saying yes a psychosis, but not the imagination psychosis. They have a psychosis few types it seems, but not the imagination psychosis. So I really don't know what to do, how to do, and things for him. So it's the brain sometimes they function, some of the part they really can't, like a logical or something. So which I'm really not keen into that. I need to help.
This is a common problem, This is a
Mhm.
common problem of this depression, Okay, then coupling with a slight autism, Okay, this is quite common nowadays. They say that out of every 5 people, one student having this thing here. So what you need to do is that you should take a proper care. Okay, of this. Then you take RGGR and spirulina, maybe
G
six.
GL
Our
and spirulina.
spirulina, RG, GL, and spirulina. 666, no? You take 6 of them, okay?
Mhm.
Then you should try to give the food that strengthen the stomach, Okay? As usual, cut down the spices. Okay? Then you can try to introduce pumpkin, pumpkin into the food. See better the pumpkin, boil the pumpkin, okay? Pumpkin, this potato, pumpkins, potato. Then all these things are good to strengthen the thing. Then also this apple soup,
Apple soup.
You chop the apple, you boil the soup with tomato. And it's a very nice
Apple.
soup. Apple soup is a very nice soup. Okay. Normally the children like to drink the soup, Then after that that will reduce the depression.
Okay.
It will reduce the depression. Okay. Then if possible, if they can practice a little bit of breathing exercise, sunya also okay. They're also good. Okay. Then take care of the stomach. Take care of the stomach. These are the thing. Then uh, take care of the stomach. Okay, then normally this without GGL and spirulina, after 1 or 2 months, normally the condition will improve. Yeah.
Okay, so there's a chance to back normal, right? Because
Yeah,
it's
yeah, yeah, yeah.
just
You can, no, no, it's not a serious problem. Even my child also having this problem, no. Austic, a little bit austic, then always quarrel, always depressed, no. Always then suddenly the emotion abrupt, they what they explode into emotion. This thing happening nowadays is quite a common phenomenon. No need to get even the teacher, write a recommendation. So I send my child for this psychiatrist to check it.
yeah, that's the thing. Psychiatry
No,
giving
no,
too
no,
many
no, no,
medication,
no, no,
and
no, no.
then
Don't take
it's
medication.
always his
No,
complaint when he's too scared,
take
he
medication is
cannot
not
urine.
necessary. Not necessary. Now,
Yeah.
in
That's
Malaysia, sometimes we also have this escargot soup, as the snail with some black pepper. We make the soup. They're also very good, but unfortunately, escargot are not very common in many parts of the world. Okay, so we may not be able to do that. But you take RGGL, okay,
okay.
RGGL,
How many
spirulina,
times, doctor? Twice a day or
yeah, twice a day.
twice a day? Yeah.
Three twice a day. Then the
Okay.
morinji also very good for depression. Morinji.
Morinji. Okay.
Emotion problem, nerve problem, numbness problem, Morinji also very good. Yeah,
Okay.
yeah. Try and see. No, you don't get panic at all. This problem can be solved. Okay, only
Okay.
thing is that you have to take care of the food. Don't put too much spicy in the food.
Can sure.
Yeah.
And
The
doctor,
spicy
I
of the
have
food
a
will aggregate the session. Yeah.
okay. I have another question. Let's
Yeah,
say the
please.
person is doing dialysis for 11 years.
Dialysis, yeah.
11 years. Can you hear
Yeah.
me, doctor? Doing dialysis for 11 years,
Yeah.
but still can urine, but not a lot, but some
Yeah.
there's a
Kidney
urine
problem,
still
yeah.
coming out.
Yeah.
There's any chance to come out or maintaining or whatever that according to your
To reverse the dialysis not easy,
not
We have
easy,
we have a few cases of successfully stop the dialysis, but the chances are very dim. Okay, because the kidney renal problem, it is a thing. Okay, so this dialysis, this thing normally our this cordyceps, cordyceps poria, cordyceps poria is very good. Okay, you can take the cordyceps and poria. I don't know whether you have cordyceps in your area or not.
Got.
Our product, if you
Malaysia
have,
got.
then you
I'm
can
from
take the
Malaysia.
cordyceps. Yeah, and also poria.
Mm.
Poria, lion's mane. In the absence of poria, you can use lion's mane. Okay,
Okay.
then you can take then of course it will not become more serious. That's very important. Okay, so that there are many patients they successfully reduce dialysis are from 3 times up to 1 times a week. We have many
That's
cases
great.
like that. Yeah. But to treat it completely may not be easy.
Okay.
May not be easy. Yeah.
Okay.
Okay. Yeah.
Thank you so much. Yes, Doctor.
Okay,
we have
doctor.
reached
Yeah.
the
Thank you.
end of the session, and it has been like almost now it's more than 70 minutes. But
Yeah.
it's a good learning thing where we can share. But again, as we doctor said, that everybody please try these soups and share your experience also.
Yeah.
How do you feel? Because we are making a record. Yes, doctor.
Two things. When it's successful or it's not successful, so let us know.
Report.
Are we successful? Then we know how it's successful.
Yeah.
If not successful, then we try to analyze why it's not successful.
Yeah.
Both also have to report.
Yeah. Please report both.
Okay.
Then
Don't only report the good news. Bad news or report to us.
yes.
No, this is a learning process.
No,
Okay.
from Doctor from Shang Han Lun, I also learned that even the wrong treatment he's explaining, Zhang Zhongjing is explaining,
Yeah.
this is wrong. Don't
Yeah.
do this, and this is right. Please do
No,
this.
he discussed a lot about wrong treatment.
Yeah.
That's the thing. He is a great teacher.
Yeah.
Not only the positive one. Okay. Then thank you very much.
Thank
See
you,
you again
Doctor.
next week.
Yeah.
Okay.
Thank you so much. Yeah. Bye bye.
Thank you very much. Bye.
So thank you, class, for attending another great session. Your sincerity praise waved for our better learning. Make sure you keep your notes, keep your questions, but put this into practice, because what Dr. Lim is teaching us, that something that's just as simple as vegetable, the spices that we have in our kitchen can become a pharmacy to help you heal yourself, not just dependent on modern medicine and the dependent on the the science that is still evolving to find ways to heal some of the diseases that from last 2500 years have already been taken care of by the great physicians of the past. So with respect to Zhang Zhongjing and his Shang Han Lun and our great teacher Dr. Lim, we end today's session. See you next week. Till then, namaste. Bye bye.